everyone. I hope everyone's having a good time. I'm Jennifer Cheng, and I'm going to tell you about a little boy named Juan and his mother, Maria. So Juan's 7 years old, but he looks more like he's about 9 or 10. Juan's pediatrician has told Maria that he's quite overweight for his age, but Maria's not buying it. In fact, she's very proud of how big and strong her little boy has grown, despite her very limited resources. You see, Maria works 2 jobs cleaning homes to make sure that Juan and his 2 sisters are fed and clothed, but Maria herself often goes to bed at night hungry. Juan was born in Puerto Rico, but moved to Massachusetts 2 years ago to get away from his stepdad. Juan says it's like this. His stepdad likes to yell a lot, and this scared his mom. The other thing you should know about Juan is that he loves superheroes, and this is his absolute favorite. Juan explains that he likes Batman because he uses his brains and superpowers to punish the bad guys and save the good guys. And he also drives around in a super cool Batmobile. But unfortunately, Juan does not live in Gotham City, but in Dorchester, Massachusetts, and he hasn't come across any superheroes yet. It's true, Juan should be eating more vegetables, but Maria did not grow up eating vegetables herself and really doesn't know how to cook them. Juan's pediatrician has told Maria that she should probably cut down on the juice that she gives him, but that's just hard because she gets the juice from the WIC office and none of the children will drink water. Juan and his sisters love to run around and play tag, but Maria won't let them go outside because she has seen people dealing drugs just down the street. Juan loves soccer and dreams of becoming a soccer star. But Maria has no idea where she would even go to find a physical activity program that she could afford for her children. All across the US and in many other countries around the world, people like Juan and Maria are being told by their well-meaning clinicians to just shape up. Eat your veggies, get more sleep, cut out the junk food, no more chips, watch less TV, exercise more, and let's not forget, don't worry, be happy. Stress is bad for your health and your weight. Well, unfortunately, as most of us with an underutilized gym membership know, things are not quite that simple. It's one thing to know we should exercise more. It's something entirely different to make that happen consistently, day after day. And I'm pretty sure things are even more challenging for families like Juan's. So in order to get a better sense of what families like Juan's are up against, 2 of our medical scholars conducted a qualitative study, and these are some of the barriers they uncovered. Denial is a biggie. Many parents like Maria simply can't accept the idea that their child might be overweight. And even if they are, surely they'll outgrow it. Besides, in some cultures, especially those with a history of poverty, being heavy is a good thing because that usually means you have money to buy food. So it's not surprising that many families want their children to be nice and chubby, big and strong. And it's not just the parents, it's also all the people who care for the children, the daycare providers, the babysitters, the teachers. I mean, what grandmother does not want her grandchildren to be nice and chubby and well-fed with love and food? So, a gym membership, how is that even possible when both parents are working, when they have no car, and when the kids are actually being taken out of sports so that they can get help with academics? And when they get there, often they're being told they can't play because they're either too young or too old. Now, Pop Warner has told Juan he can't play football because his weight is not in the right weight category. But that's interesting because if Juan's weight were in the right weight category, maybe he wouldn't need to play Pop Warner football in the first place. And as if this weren't enough, then there are the mixed messages. Maria is very confused. So it's 100% fruit juice, and the WIC office gives it to her so that she can give it to her babies, but it's not good for you? And what does organic mean anyway? One mom was so confused, she actually thought that calories were more nutritious and better for you. So with all of this nonsense, is it any wonder that families lack the confidence to implement changes at home? How can they not feel defeated when they've tried so hard but have failed again and again? Why should we blame an overweight adolescent for finding comforting food when she's ostracized and bullied by her friends at school? An even bigger question is, how can we apply what our families are telling us to interventions that will actually work for them? So while you ponder that thought, I'm just going to put in a little plug for my scholars. And if you'd like to read more about this topic, please look for Lauren's and Sarah's article in an upcoming issue of Clinical Pediatrics. So with all of these obstacles, how does anyone succeed? How do stars like J.Lo shed 40 pounds after having twins in time for bikini season? How does Sylvester Stallone stay ripped at the age of 62? Has anyone seen The Expendables? I mean, it's pretty incredible. Well, I'll tell you that having a personal trainer like Gunnar Peterson probably doesn't hurt. But unfortunately for our families, Gunnar Peterson's pretty booked up, and his studio is a world away. So what options do we have? Well, it would have to be someone who's a little bit more available and a lot more affordable. Wait, I know. What about pre-medical students? They're smart, they're young, energetic, and eager for volunteer experiences where they can do more than color with children in the waiting room. Even better, they work for recommendation letters. And so why not put this wonderful resource to good use and also get our future doctors excited about primary care? Why not train students to serve as health coaches on a medical team? So drum roll, please. So I'm very pleased to announce that after a period of intensive development, we at Boston Children's have come up with our own version of Gunnar Peterson. Dun, dun, dun. So our Steps to Health coaches work as part of our medical team to educate families about nutrition, not by just telling kids not to drink soda, but by actually showing them how many cubes of Coke are in a can of, how many cubes of sugar are in a can of Coke. Does anyone care to venture? Linda?
4?
10. That would be 10. They don't just tell families to exercise more, they actually call them to egg them on towards their goals. They refer families to cooking classes and farmers markets and map out routes to local parks. They can also help families develop realistic steps to health plans and then call them to check in, troubleshooting barriers together. Finally, they look back to the medical team to make sure that everyone's on the same page. And thanks to our Steps to Health coaches, 76 families have been referred to local activities that are free or low cost in their community. 17 families have been referred to our Saturday group sessions. 11 moms like Maria have signed up for healthy cooking classes, and 98% of families served have said that they were very or extremely satisfied with the service they received. Our hope is that together we will forge a healthier family, happier future. And this is thanks to everyone who makes the seemingly impossible possible.